Paid lobbyists and executives of the healthcare industry met in San Francisco to lay plans to extract more money from American healthcare. But outside the conference hall, hundreds of healthcare activists demonstrated to demand single-payer healthcare that would eliminate the insurance company middlemen completely.
They served our corporate interests and we told them what to do. This gravy train would stop the day a real pitch through. We love the status quo. Our insurance corporation loves to someone regulation. We are burning relation. We love the status quo.
San Francisco Labor Council, and we represent here in this wonderful city over 100,000 men and women who do work under a collective bargaining agreement that have family medical care and all the good benefits. We have the opportunity to work on certain issues. And our union firefighters that come by. And we have the opportunity to work on campaigns that can raise the floor on so many issues. And it is no coincidence, it is no accident that San Francisco Labor Council was the first labor council in the United States to support single-payer and universal health care. It is no accident that we helped lead the charge with the California Nurses Association to support single-payer and universal health care at the national AFL-CIO, and that is the position that we have. Organized labor is for single-payer. It is no coincidence that the endorsed state senator from San Francisco, Mark Leno, has taken the mantle from Sheila Kuehl and supports the single-payer bill that is alive in Sacramento. It is no coincidence that all of you are here today, and it didn't take the great organizing of Henny Kelly and Don Beckler and the single-payer folks to get us moving. You guys are here because this is a campaign. This is a campaign that is not going to go away. It's not going to go away because organized labor is not going to let it go away. It's not going to go away because the community organizations are not going to let it go away. It's not going to go away because the activists in San Francisco and California and throughout the United States are not going to go away. This is a crime that we have to pay so much for health care, that we are denied health care, and that we have the situation that we're in.
Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out.
It's like a family reunion for me. I'm good. Very good.
Nobody out. Everybody in, nobody out.
There's a megaphone. It's just screaming.
Listen, brothers and sisters, this is such an important issue. Our biggest issue has to do with jobs, but the biggest overall issue has to do with health care. And I don't care if you are just getting out of college, you're just getting out of high school, whether or not you're a senior, whether or not you're working under a collective bargaining agreement, or whether or not you're being exploited by a Walmart type of an employer. The biggest and most important thing that happens in the United States that people worry about is health care. And the group of people that are inside this building right now are not helping us, are they, brothers and sisters? I finished yesterday participating in some bargaining with some employers and with some unions. We spent 3 hours bargaining. Guess what the most important issue was? Healthcare. What was the most important issue?
Healthcare.
Luckily, because they were working under a collective bargaining agreement, we ended up with what we call a maintenance of benefits. So that no matter what these knuckleheads inside the building are doing, for the next 5 years, this group of employees is not going to have to worry about their health care because the employers are going to pay for it. But is it fair to the employers to wake up every year and wonder what the heck they're going to have to pay because the guys inside the house here are going to raise the rates no matter what the hell is happening with no regulation?
No!
Every time we sit down, when we think about our retirement, when we think about, you know, how we're going to be able to pay our rent or our mortgage, the biggest thing on our mind is, how much is my health care going to go up? And there's something fundamentally wrong that we have to deal with that in the United States of America. Isn't that right, brothers and sisters?
Yes!
Round one, and the challenger, the American family, and the American family comes out strong, ready to fight for the health care the family needs. Dad swings a right punch, but the insurance monger ducks. The giant delivers a cheap shot below the belt. Grabs the hard-earned money off the family and sticks it on his garment. But wait, Mom's moving in. Looks like she's had enough.
Again, oh, he's getting wobbly. He's getting ready to go. One more. Oh, here it is. Here we go. Again. He's going. Okay, he's down.
So I want to thank all of you for coming out. I want to make sure that we keep our voice loud and clear so people inside, and I'm glad to see that we have some of the media here to know that we are not going to go away. Right? Right. We're going to stay here and we're going to fight for the fundamental right to have universal health care. It is an absolute civil liberties right that we all have health care. I'm proud of the labor movement for staying where we are. I'm proud of all of you and all the different activist groups for continuing forward. Single payer now! 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 Thank you, brothers and sisters.